What's up? What's up? Take 5.
The question I'm going to address today is child obesity a problem, and how do you manage it or combat it? In recent statistics, AACAP, which is the American Academy of Child Adolescent Psychiatry, said that between 16 and 33% of all children are obese. Another reason why this is an important issue is 1 in every 3 Americans are obese, which was off of ABC News. AACAP also said that there is an annual cost to society of $100 billion in health care. It is also one of the easiest medical conditions to have, but it's the hardest to get rid of or treat. CBS also said that recent increases in diabetes have been because of the fact that people have been obese in childhood, and this also added millions to the health costs. Another doctor, Miza, which I read on CBS, also said that kids that are fat just keep getting fatter, so the problem keeps increasing. Another reason why I think this topic is important is because obesity is responsible for over 3,000 deaths a year. It also stated that obesity in children is twice as likely to result from them dying before the age of 55. So they're basically their parents are basically outliving their kids. Obesity is obviously a problem in children, and now we're going to discuss how big of a problem it is, why it is such a bad condition, and how are you supposed to manage it if you are obese. First, we'll talk about how big of a problem obesity is in children. As we already said, 16 to 33% of children are obese. Another statistic said during the AACAP said that children with one parent that are obese is 50% more likely to become obese too. And if they have 2 parents that are obese, then they're 80% more likely. Also, another stat said that children are 80% more likely to stay obese if they are as a child. So chances of becoming obese are a lot more likely in kids with parents that are obese. Obviously, obesity is common, and now we can talk about why you need to fix it, because it is just a physical appearance, what most people say. So reasons why you should, which we already stated, it causes 300,000 deaths a year, and it also has a lot of physical and emotional risks. Some of the physical ones are an increase of disease and heart disease, blood pressure, the diabetes, which we've already mentioned, breathing problems, and trouble sleeping. And on an emotional level, it also results in low self-esteem in kids. It's harder for them to find friends because they're uncomfortable with how they look in school, anxiety, depression, and obsessive compulsion disorder. So obviously it should be managed because of those I've just mentioned, and now we can talk about how you're supposed to manage it. CBS said that you just need to be active, and they got a bunch of celebrities together, and all they said was they just need to do whatever, just move your body. AACAP listed 7 things that you can do to try, like starting a weight program like Weight Watchers, which you've all seen on TV. You can also just change the way you eat, exercise, have less portions, watching your calories, limiting snacks, and using food. A lot of people use food as a way to reward themselves or just to cope with something, so stop doing that, find something else, and getting a local support group about obesity and trying to watch your weight, which is also just like Weight Watchers. So going back to the original question, obviously we answered the fact that it is a big problem and it needs to be managed. So I think that we can all agree that it has a lot of risks, which we've mentioned, the death that it can cause, the physical and emotional, and people need to learn how to manage it. But it is ultimately up to that individual to decide if they should manage it, though it might cost the rest of society money and might cause them future problems. So, anybody have any questions?